Thank you, David. So for those that don't know me, I'm Amanda Small. I'm the Deputy Chief Nurse here at CUH. And as David has so wonderfully introduced us, we're here today to talk about non-medical research, so nursing, midwifery and allied health professional research. So we've recently launched the non-medical research strategy, and that really focuses on ensuring that the care that we deliver to our patients is evidence-based and provides us with the opportunity for the workforce to generate their own evidence. So to get involved in research, to be really looking at the specialist care we deliver and generating their own evidence related to that. There's lots of evidence nationally that supports the view that if you're a research active organisation, that actually people really want to come and work with us. It gives people a different development opportunity and a different career framework, so helps to retain staff. And there's loads of research opportunities and research pathways out there for you all. So I'm going to introduce Alex and Colin. So Alex Mallion and Colin Hamilton are the leads for non-medical research capacity and capability, another mouthful, we like long words. And they will talk about all of the different opportunities and pathways that are available to us here and the support that they can provide you within their role. They are joined by David Young and Andrea Lake, who are going to talk about their personal stories of the research projects that they've been leading and what a difference it's made to their patient care and to their career development. So over to Alex and Colin.
Thank you very much, Amanda. That's a great introduction. And thank you to all for allowing us to join you this morning. It's a great opportunity for Colin and I to introduce ourselves as the leads for nursing, midwifery and allied health professional research within the Trust. And we just wanted to talk a little bit about the different ways in which we can support staff who are interested in getting involved in research, who want to do some research education. There's lots and lots of ways in which we can support you and signpost you to all those opportunities that Amanda's talked about. So please do get in touch with us if you are interested in getting involved in research. We can support you if you have an idea that you want to develop for an audit, a service evaluation or a small research project. We can support you with those research projects, delivering those. We can help you with major projects that you might be doing for a master's or a degree pathway. Please do get in touch with us if you're on one of those pathways. We would love to support you with those projects. As I say, we can signpost you to the various opportunities that there are and support you with applications for internships and fellowships. There's many, many opportunities for those. I won't go into all of them today, but we do advertise them regularly. So if you're thinking of putting in an application for those, again, get in touch with us and we can support you with that. We can give you guidance on writing papers for publication or preparing a presentation if you want to take something to conference. And we can provide career advice for people who are interested in a career in research or a clinical academic pathway like David and Andrea are going to talk to you about today. And we can also signpost you to any other research and education training opportunities. So as I say, there's lots we can do to support you. So please do get in touch with us. One of the projects that we are involved with at the moment that I just wanted to talk about before I hand over to Colin is the Chief Nurse internships, which we are just in the process of recruiting our first cohort of Chief Nurse interns, which we're very excited about. And those are really designed to support frontlines. Apologies, there's a slight interruption here. Designed to support staff to develop research and innovation skills while also developing as future leaders within the Trust. So there'll be two components to the interns. They'll work on a research or quality improvement project as a small team, and they'll also have a personal development plan so they can develop their research skills. And the idea is that they really take that learning and the development and take that back into practice so they can share that with their colleagues. So they're a fantastic opportunity. As I say, we've already recruited the cohort for this year, but we're hoping that this will be an annual thing. Yeah, very exciting. I'm going to hand over to Colin now, who's going to talk to you about one of the other projects that we are working on.
Hi there, I'm Colin Hamilton. I'm one of the other leads for nursing midwifery and allied professionals research. So another project that we're working on is looking at what the priorities for, as Amanda mentions, non-medical research within the trust. So we're going to send out a survey. It's going to be in the bulletin hopefully in the next week or so. So keep an eye out for it, which will be looking for you to fill in what your questions are. It might be something really small, like how do you get the NG disconnected from the NG tube when someone like Superman has put it on and you're desperately trying to unconnect it. There's something big like how do we recruit and retain the best nursing staff to join our teams. If it's a question that can be answered by research, even if you're not sure, if it's a question that's important to you, we want to know it and we want as many as possible from as many groups as possible. We describe ourselves as nursing, midwifery and allied professionals research. That last bit's really broad, and as Amanda says, non-medical research fits it quite nicely. You don't have to be one of the AHPs to fill this in. We want this as broad as possible because there are questions that people who are not in one of those three big groups will have that other people won't have. And those are the important questions to draw out. So it's a really short survey, only take you a couple of minutes of your time. There's a little prize draw to hopefully entice you in as well. And what we're going to do eventually is when we've got that big long list is try and divide it up by professions, prioritize that. So eventually we get a top 10 for the trust of the most important questions that we want addressed. So wonderful researchers like David and Andrea, who I'll introduce you in a second, and from universities, or if someone's doing a master's project and wants an idea of a project to be working on, we can say to them, these are the 10 things that we really want to be. So it's an exciting thing to do. Do keep an eye out for it. It is going to be quick. It's going to be easy to fill in, and it's people like you. We want people on the ground. That's what we want. We also want admin people. We want managers. If you're finding it difficult to recruit and retain staff, that's exactly the sort of question that's amazing and really important for research to answer. But as I say, it can be something far more clinical as well. If it's important to you, we want to hear about it, is basically it. And don't think that you're limited by your profession. As Amanda says, basically it's anything non-medical. And that's not to put aside our medical colleagues, but there's good structures there. And what Alex and I are here for is to support those other professions in moving forwards. There's another little thing we're putting together some dot training for people on research, how to build a research question, how to search the evidence. So keep an eye out for that as well. There's going to be quite a lot coming from us as Amanda mentions, deliver this research strategy. So do keep an eye out for the things that we're going to do. Just harking back to James, if you do want to contact us, then I'm going to be colin.hamilton, then the numeral 1 at nhs.net. And Alex, you're Alexandra.Mallion?
Yes.
Alexandra.Mallion at nhs.net. So please do get in contact with us if you have any questions or we can be any help. What we wanted to do next was to introduce you to some of our wonderful professionals who are doing these careers and answering these questions. So we've got David Young, whose background is he's a physiotherapist. He then moved into the major trauma service, working in the, it's got a great title as well, Pediatric Major Trauma Rehabilitation Coordinator, and then moved on to his, you should see some of the badges we have, and then he's moving on to his PhD now, and then Andrea Lake, who's a CNS in diabetes as well. They're both doing wonderful projects, but I'll let them introduce their projects as well. So I'm going to start with Andrea, if that's okay.
Yeah, brilliant. Thank you so much for the introduction. I just want to say, Colin and Alex, that all sounds really exciting. And I think I just want to back up that actually, you know, I was privileged to be one of the first nurse in the East of England to be awarded an NIHR Clinical Doctoral Research Fellowship. And I just can't support enough the need to find a strong evidence base, not just for the pills that we give, but for the ways in which we do things. It's really important that we have strong evidence for how we do stuff. And I think what you guys are planning on doing sounds really exciting. So just a bit about myself. Yep, diabetes specialist there. Started off, it was a full-time job, 1 year fixed term, and it came with 1 day a week research. I knew nothing about research. I wanted to be a diabetes nurse. So I remember even saying in my interview, they said, you know, it comes with 1 day a week research. And I said, I know nothing about research, but I work really hard and I learn fast. So, and I was very lucky to get the job. And actually, over many years, a absolute passion for research and diabetes developed. And I think one of the key things about these pathways for me is I really felt like I reached a point in my career where I understood being a diabetes specialist nurse, and I loved it. I loved that patient contact. I loved being able to help them and deliver great care. But I also loved being able to solve problems and identify issues and find solutions and work as part of the research. And I really felt like I'd reached a point in my career where there was no progression for me anymore. I either had to choose to either go up a clinical management route, or I had to choose to go down a research management route. And that's when I was so lucky to go to a conference where they happened to mention clinical academic careers for nurses, midwives, and allied healthcare professionals. Because prior to that, for me, in my understanding, that was something that was for doctors. And I didn't actually know that that was even an opportunity that I could even try up until that point. And then from there, the rest is really history. I got a fellowship with the NIHR where I got to do my master's. So I have a master's in clinical research. I was supported by bridging funding to do my application. And now I'm, like I say, NIHR Clinical Doctoral Research Fellow. And currently I have over 220 recruits from Addenbrooke's, and I'm exploring how diabetes is managed in the hospital, both exploring a quantitative approach, so with numbers and looking at comparisons, but also qualitative, so I'm interviewing staff and patients to really get a better understanding of how and why things work the way they do. Again, to get that evidence base of, you know, it's not just what we do, but it's how we do it. So I feel really privileged to be in that position. My manager, Katie Davenport, has been superb support for me and has been so open-minded to not only the benefits to me individually for my development, but also the benefits to our patients, the benefits to the service. You know, I've brought income into the department and brought in staff funding as part of my project fellowship. So there are multiple benefits, not only for myself as an individual and career, but also for helping the people around me and also the department, I hope, as a whole. I was very lucky recently to be asked to do a CUH My Story. So if you wanted to know any more details, then please do have a look on there. But otherwise, I think that's kind of the summary of what I wanted to say, really, and I'll hand over to David.
Yeah, good morning, everyone. Thank you so much for having me this morning. And really just to echo what Andrew was saying earlier, it's fantastic to see these pathways developing, see Colin and Alex really working so hard to develop the opportunities and the firm foundation, really, so that others can follow similar paths to Andrew and I. So as was mentioned earlier, I'm a children's physiotherapist. I specialize in neurorehabilitation and more recently in trauma. And it became sort of quite a natural fit for me to look at the area of traumatic brain injury. So these are sorts of injuries where children perhaps are in a car crash or they fall and they bang their head, and look a little bit around some of the rehabilitation that they receive, certainly from the hospital perspective. But what I was really interested in is how we work with families. So of course, we understand that children exist within the context of their family and their family unit. And whilst we focus a lot on the children, I sort of increasingly was aware that the parents, certainly from a physio point of view, aren't necessarily as well sort of looked after or considered. And I always sort of thought, well, surely that's psychology, isn't it? I'm a physio, I'm here to do the physical stuff. But actually, parents benefited a lot from the psychological side of things. So what I'd say is I'm sort of occupying the space between physiotherapy and psychology somewhat, where I'm looking at some of the needs that the parents have in order to really support them and help the child, not necessarily only in the hospital, but certainly when they leave hospital and return home. So parents in these situations, it's very complex and very difficult, and of course, very traumatic. But parents take on an awful lot. And some of that is that they have to carry on delivering physio and therapy to their children when they go home. So I spoke to some parents in the hospital. I sort of used the opportunity to do some patient and public involvement, as we say, by just having a chat with some of the parents. And they said to me, well, surely there's better support than a piece of paper to help me do exercise. Isn't there an app, or isn't there some technology to do this? And the penny dropped really for me. I thought, well, there isn't, but there should be. And I'd like to sort of help to do that. So my research is mainly sort of qualitative. So speaking to people, understanding some of the themes of what they're telling me, to try and develop some support for parents so that when they're in the hospital with the physio, they can sort of start to use some technology and an app to sort of populate the rehabilitation that they'll be having. And then when they go home, they've got this to use, and it gives them prompts and reminders and updates and things like that. And hopefully this will fit really well with the technology arm of the Cambridge Children's Hospital, so that that sort of has a natural place to fit and is a place to sort of implement when it's sort of developed and used. And for me personally, it's been a huge learning curve. So much like Andrea, although I didn't have a research part of my job, I didn't really know much about research. You know, I started as a physio. I learned a lot of skills to do with physio, and then I realized that there's a few gaps that I want to look at a bit further. I just showed a bit of interest, and lots of mainly doctors who were involved in research said, here's someone who's keen, let's give him a few projects. And before I knew it, I was sort of up to my ears in sort of research opportunities. But from there, sort of went to a master's and a clinical master's and now a PhD. And what I'd really like to say is that if you do have a question, as big or as small as it might be, if you're passionate about it, you're interested in it, and you really want to understand some of the answers to those questions, then possibly a clinical academic route could be for you. And I think it's definitely worthwhile having some conversations and starting to get the ideas of a question developed, because you know, it may not only be you who answers this, it could be your whole team or a network of people, but it's really, really helpful to do that. And it gives you a different understanding of the clinical work that you'll be doing, or the types of issues that you'll be dealing with. So I think that's me done for now, but thank you again for the opportunity.